Hello, we are now at day 2 of this 22nd Cardiac Ultrasound meeting in Davos, Switzerland, 2023. And we already had some amazing topics and lectures from experts from all over Europe and around the world, actually, United States. Yesterday we had a lot of talks about assessment of the left, the right ventricle, and the left atrium using strain imaging. In the afternoon we had some valve disease assessment. Today, tricuspid valve, right ventricular function. We are very lucky to have Professor Michel Zuber from Lucerne in Switzerland and Professor Jeroen Baks from Leiden in the Netherlands. Amazing people to share the knowledge. Faculty, the rest of the faculty, Joe Kislow from Durham, North Carolina. Michel, what really impressed you so far from this Davos meeting?
Okay, I'm following this meeting since many years, and I think since nearly more than 15 years. So I'm really impressed about the quality of these presentations. I have not seen one presentation that is bad, and really everything is practically oriented. So it's not only something for experts, because we can learn and translate what we see here into clinical practice. I think this is very important to know.
Yes, it is addressing really problems that people who are using echocardiography in the daily clinical practice, how to use best and what perhaps not so often.
You know, we say not that everything is good. We focus also on the problems. That is very important, where you have to look for. And we don't focus only on echocardiography, because now we have multivalvular or multi-interventional approach and so on. So we also add all kind of images like MRI or CT.
Sure.
So we have a really a total
integrated approach.
Yeah.
Jeroen, we've been doing this meeting for many years. What do you think it is special this year for you?
Well, before we go there, how many years have we done it? Or not we, but before us, Jos Roeland, how many years has it been?
Over 44 years.
44 years. This course has been standing and still going strong. Well, what for me was one of the highlights is, of course, in cardiology, we become more and more aware of heart valve disease that needs transcatheter repair and replacement. And we had excellent sessions today about treating the mitral valve, treating the aortic valve, and also the master here on the very left talking about the tricuspid valve and how to work with that. It was really spectacular. And this is really up to date, highest standard. And the audience, as you said, is quite mixed. We have people that are working echo clinics, but we also have a lot of people that work with transcatheter valves, guiding the procedures, providing the information to the operator. And I think this was really spectacular for me, spectacular. Absolutely. The one on the left again, he did such a superb talk. I enjoyed it.
Michel also runs this course in Lucerne for how many years, Michel?
30 years. Yeah.
So it is this Davos course and the Michel Zuber course in Lucerne are probably the oldest still standing courses in Europe about echocardiography, isn't it? We have seen the development of echocardiography for so many years. It's quite impressive.
And look where we are. We switched mostly from 2D to 3D, coming into the practice more and more, also for the valves, what you showed. And we've introduced concepts like LV strain, RV strain, no longer talking about ejection fractions, but how do I express my function of the heart, moving towards the strain. We talked a lot about atrial fibrillation, what the effect is on the left and the right atria, what are the implications for catheter ablations, all this sort of things. So we moved from diagnosis, where we spent a lot of time over the years, to guiding treatments and defining what are the therapeutic options, really shifting.
And don't forget, we have the risk management and the future that we can really have an information now by simple echocardiography or by advanced echocardiography.
Yeah.
That's really great. And this in Davos, wonderful weather, lots of snow, don't have much time for skiing, but really a nice place to be. So thank you very much. We continue still tomorrow. We have another full day and more to come. Thank you.